Here's the answers to your application of vet nursing care mock examination, which was sat on the 16th of December 2020. Please do remember to upload your marked papers using the lead submission, as it allows us as teachers to see where your current progress and current understanding lies. It also gives us the opportunity to refine our revision approach, which we'll be doing together in January. Okay, so let's look at section B of the exam then. So just to remind you, section B is worth 50% of the overall mark. And as a result, we would expect you to spend at least 50% of the total time on this question. As with previous level 5 exams that you've had mocks in the actual exam you will have 2 questions to choose from, but please remember you only need to select 1 question to answer. We have unfortunately had students in the past that have unknowingly answered both questions, which, bearing in mind you're only going to have 45 minutes for this essay, leads you to have a very short time allocation if you're going to attempt both. So say, remember, just 1 question, but it is entirely up to you which question you select. What I would encourage you to do as well is to make sure you do plan your answer, particularly because you have at level 5 got to demonstrate analysis and refinement within your answer. So do make sure that you in the exam have a close look at the question, work out what the key themes are, and then even if it's just a very short 1-side page plan, do make sure that you actively make a plan so that you have some idea of what you're actually doing. So the question that we set you was with reference to pathophysiology, outline the etiology, clinical signs and diagnosis of feline hypothyroidism, evaluate the non-surgical treatment and nursing interventions available in home care management of a patient following this diagnosis. So again, we can break this question down. So we're expecting to see a discussion of etiology, clinical signs and diagnosis, and your specific patient is feline hypothyroid, and we're looking specifically at non-surgical treatment. So that should be your emphasis with discussion of nursing interventions, and we're thinking about home care management. So please remember not to include or we wouldn't expect to see anything around intensive nursing processes or treatments that can only be provided within the clinical setting. So this question is worth 100 marks, and once again this is being marked using categorical marking. Okay, so let's have a look then at categorical marking for this particular essay. So as we've previously mentioned in previous mocks, the method that we use for exams is standardised across all level 5 programmes, and as a result the structure or the markings criteria are quite broad, but we do focus it to specific themes within your particular exam. So in order to achieve a 39 to 30, which would be considered a fail, this is basically where students have failed to address the question, and it's substantially incomplete, and there are clear deficits in your discussion. Now in this particular example, it's if you haven't described anything to do with pathophysiology, clinical signs or etiology, and the content is very weak. So there's limited discussion of home care, there's limited discussion of non-surgical techniques in the management of hypothyroidism, and it may not even be clear that your patient is hypothyroid from what you have written. So in order to achieve a pass, so 40 to 59, students are required to attempt some basic information which addresses the topic and demonstrates some understanding of basic aspects of the subject matter. So we would expect you to provide some recommendations for nursing interventions, but these might be simplistic in nature and don't really show much indication of research or wider reading, and there is limited use of citations, but we would expect there to be some level of organisation to your structure, but there are spelling and grammatical errors. So whilst you have demonstrated subject knowledge, the actual refinement and approach you've taken is quite limited and quite simplistic. In terms of the 60 to 69%, This is a much better piece of work, so it demonstrates a well-presented attempt which covers the subject matter in a lucid and clear style. You've demonstrated evaluation of current research and included relevant citations, and you've made quite specific evidence-based recommendations designed to support nursing interventions with recommendations for management of chronic health concerns. And overall the structure is very well presented, it's well organised, there's good use of structure and language, and there's also careful use of grammar and spelling. So we would expect there to be evidence of draft reading, and obviously remember in your exam it is highly recommended that you finish a few minutes before the end of the exam to give yourself time to read through things and make sure that what you've written is clear. Now, I personally find this really helpful, because I know that in an exam situation I tend to write in a bit of a flurry, and again, I don't know what you guys are like, but I personally find handwriting, as weird as it sounds, I tend to find that I don't make correct sense from the very beginning. So if you are like that, make sure you give time for draft reading. Make sure you actually, even if it's just one draft read before you finish, it's really, really important. To achieve a 70 to 79%, you're expected to provide excellent work, and you should be demonstrating both evaluation of the pathophysiology and the nursing interventions that you have recommended, and there should be evidence surrounding your recommendations with evidence of analysis and specific research sources. It's also expected that you include several relevant citations which are kind of clear and well articulated to the subject matter, and there should be no errors in organisation, structure or grammar or spelling. So overall it's a much more superior presentation. It's written well, it makes a lot of sense, it's relevant to the question, which would then lead us on to the 80%, and believe it or not, 80% is more than achievable in an exam. And basically what you've demonstrated is excellent work. Again, you've evaluated pathophysiology and nursing interventions, similar kind of level of research demonstrated, but the key thing here is you've demonstrated imagination and a level of knowledge and insightfulness that is unexpected at this level. So that's what the method that we'll be marking your essay questions to, but obviously with all questions there are things that we are specifically looking for. In this particular case, if we look at the question as well, obviously it's describing pathophysiology, etiology, clinical signs and diagnosis. So we, as with all essays, we'd always expect there to be an introduction to start with, and in this situation we would expect there to be a definition of the disease, description of etiology, clinical signs and disease status. Now the question itself identifies those things as requirements, so I would hope that again, if you're clear and you highlight the things that are expected, that should be quite self-explanatory. But it's always worth checking the question at the end of the exam to make sure that you have done that. At level 5, as I say, we are expecting analysis and discussion, so there should be reference to those, making it really clear from the start. You then want to think about, in this case, thinking about the causes of disease and how that relates to clinical signs. So that's going to be your pathophysiology. So what is it about the disease, specific cause that leads to the clinical signs that we see? For example, why does a benign tumour lead to increased thyroxine production? Remember we talked about the HPA axis and how certain hormones will interfere with each other. So again, are there any particular hormones which predispose the animal? Are there any predispositions generally? Those kind of things would also be relevant. So the next bit then would be your methods of non-surgical treatment. So you may have discussed specific diet modification or the use of specific medications, and the key thing with these ones is you're thinking about home care management. So again, it's about identifying specific treatments that will allow for discharge of the animal and stabilization at home. We don't want to be recommending treatments that are inappropriate for a home setting, nor do we want to recommend something that's going to unstabilize our patient quite significantly. So the next section we would expect there to be is a level of discussion of monitoring, and this would also bring in your methods of how you're going to support client understanding and how you're going to support home management. And because, as we know, one of the main triggers for kind of poor management tends to be where owners fail to understand or have a misunderstanding of expectations or treatment requirements. So that would be a nice theme to bring into this particular question. And as we know, nursing interventions can be key to maintaining a good level of support of clients in the home setting. And then as an extra bit, you could have also discussed surgical interventions if limited success was seen from your non-surgical. So whilst the question says non-surgical, there is scope to discuss surgical interventions, but it would be as a second response. So again, do not start the question by talking about surgical, because that's non-relevant, that's not relevant. However, having said that, if you have an animal that is unstable and it's not possible to stabilize, for example on medication, then you may well consider doing a thyroidectomy, for example. So there is scope for those kind of questions, and there's kind of areas to come into. But as I say, instead of just simply throwing every piece of information you know about this particular disease on your essay, it's worth thinking about what is relevant and how can I refine it. And again, that's where you're going to have your analysis coming in. For example, it might be that you have research that expresses a certain approach to management. Those would be things that you could discuss at length. Okay, so I hope that's given you some guidance on how the section B is marked for this particular exam. As always, if you have got any questions, please do email me directly. We will be running revision classes on the 6th of January. So as previously mentioned, do try and get to those sessions. They are really beneficial, particularly for face-to-face contact. If you can have a go at marking your essay question, please then upload it onto LED using the submission. And as always, if you haven't got any questions, please come and find us.